Thank you very much. Well, what I just wanted to announce, this is a new campaign, Fight Lyme Now, and really it had its origins in the first, well, I have to say, parliamentary conference that we had in January. And Armin and myself, we presented at this conference. Demetrius is waving madly at the back. He organised it. Oh, sorry, yeah. Stand in the limelight, yeah. So Demetrius Lucas at the back organised it, and we had present at the meeting Tim Brooks and his team from the PHE. One of the presentations that was given was a very remarkable presentation showing what apparently were organisms in peripheral blood. Now, I have to describe them as organisms. I mean, it has been indicated that perhaps these are bits of fibrinogen or some conglomerate of protein. They're really not. I've now seen many, many more videos of these sort of appearances. And people whose family members are ill, for example, a recent video I've seen, a wife of now a friend of mine, a patient, but a friend of mine, I should say I work or help out at the Well One Clinic in Beverley. And I've seen a picture of her blood, and there are things in there that shouldn't be there. And these apparent organisms need characterization. Anyway, at the end of we had a long meeting at Porton Down back in the summer. We had a 6-hour meeting with Tim Brooks and his team. And one of the admissions was that the actual testing they're doing is not totally reliable, and we hope that information has been disseminated. It needs to be disseminated, but that was from, I shouldn't say the horse's mouth, but that was from Tim Brooks's mouth. So we have that sort of admission. My interest is to develop direct testing methods. At the moment, the testing is indirect. We look for a sort of shadow of the organism by way of the reaction of the immune system. So Porton Down run antibody tests. They run an ELISA first, and if you're very lucky, if that gets a positive, you then get an equivalent. It's not a Western blot, it's a new test system. But really, the ELISA is superfluous. They should forget the ELISA, go straight on to the second-tier testing. But what we desperately need, I mean, the T-cell test is very good. It's still an indirect method. We need to be able to say, what are these organisms present in these blood samples? The gauntlet was sort of laid down by Tim and his team, saying that they would use their methodology to prove, or disprove whether these apparent organisms were Borrelia. I was very worried about this because I was just saying to Sarah earlier that there's a method called polymerase chain reaction that many people here will be aware of. No two polymerase chain reaction systems are created equal. They're really not. It's meant to be a very sensitive method. Guy that set it up in the late 80s won the Nobel Prize for it. And it's thought to be extremely sensitive. It is, but only under the right circumstances. And when I looked at, I was handed a paper by Amanda Semper, who works at the PHE. She handed me the paper of the method that they were using to do the quantitative PCR. I made a critique of this and sent it back to PHE. I was a little bit dismayed, the fact that what they probably do is throw most of the organism away when they assay for Borrelia. We've been doing work now, and I should say I'm sort of set up a very loosely affiliated team. We're working in different geographical locations across the world and in the UK, where we're showing an association of the organism with the platelet fraction of blood. Now, the problem is here that if you use archival serum samples, most of the organism will have gone. You'll have thrown it away. So when I say no two PCR reactions are created equal, I should say assay systems, and that's the totality of the system, from taking the blood sample, from extracting possibly DNA, or even isolating the organism, to running it through the procedure. And most of the PCR reactions are set up incorrectly. So, in order to address this, we're establishing this campaign called Fight Lyme Now. There's even a campaign song. This is a campaign to raise funding through crowdfunding, specifically to improve the testing, the clinical testing of Lyme disease. So we're looking for Borrelia. one of the things we have to do is to increase the sensitivity of the overall system to directly detect Borrelia. So we will use conventional methodologies. We will use some very, very new methodologies, hopefully, if we can get funding. And perhaps, John, I can sort of ask whether it's possible that you help out too. But there's a very new methodology that is using a microfluidic system. One of the sort of preliminary versions of this, we're going to be doing some work with a company called Bio-Rad. They have a system set up in Liverpool. There are a number around the country, but there's an even newer system, but it's not commercial yet. What this does, it would potentially allow you to look at single organisms in several mils of blood. What they set this up for was to look at septicemia. They were looking at E. coli in several mils of blood. They were able to identify one single organism in several mils of blood. This is an extraordinary technique, and if we can get our hands on this and develop it for Borrelia detection, then we really are going somewhere, because although the perception and the understanding is that it's not detectable in blood, I think Alan MacDonald has sort of put that one to bed, that it is detectable in blood. And the things I've seen, these are organisms, they're not inert. So what we have to do in these blood samples is actually characterize what they are. So this is the sort of spearhead of this Fight Lyme Now. It will go live next week. So we're setting up on a crowdfunding platform, You Caring. Also, we're working with Neil Coyle, the MP for Bermondsey and Southwark. Sir Simon Hughes, who was the Lib Dem MP for, Demetrius Lucas is MP. So Simon Hughes was instrumental in setting up the parliamentary meeting. Unfortunately, he's no longer the MP. I shouldn't say that because Neil Coyle seems a jolly decent chap. We've spent hours and hours and hours, Demetrius and myself, with some of the patients, sending this survey off to a number of patients and GPs and scientists to perfect this survey. We have a survey which is going to go on Neil Coyle's website, and I'd really like to ask John if he'd help us distribute this survey. And it's really to work out the financial and societal implications of Lyme disease, because Neil is going to try and use that to lobby Parliament. And really, unfortunately, that's the only thing the politicians listen to. How much does it cost, and how much will we save by getting the testing sorted? Thanks ever so much.